All right, so I've just powered out like a quick little kind of guide to St. John of God's applications because they are open at the moment. And I want to make a really strong disclaimer on this. I have not successfully got a grad at St. John of God. So this presentation is more just about how I would approach these applications. It does not necessarily mean this is specifically what St. John of God wants. I haven't got feedback from St. John of God recruiters. I can't bring that same kind of experience to St. John of God that I can to Grad Connect. So this is more just kind of generally how I would approach this and not necessarily how you should approach this. Remember, you have on the information from St. John of God, there is the information of who you can contact at St. John of God if you have specific questions about them and their program. So don't hesitate to use those resources. They are there and available for you. In the application, St. John of God specifies the things that you need. So you need to do the selection criteria. So this is in the information they provide you. This is the 3 questions they want you to answer in the application. They're a little bit, it's almost slightly confusing when you first look at it because they sort of have selection criteria essential and then a whole list of items, and then they say application. They only want you to answer those 3 ones from the application, not all of those kind of other essential things. Like, they're essential, but you don't need to put them in your selection criteria. They want a CV or resume from you. So there's a max of 3 pages is what they've specified. It doesn't have to be 3 pages. If yours is only 2 pages, that's fine. As a graduate RN, I would say at this stage it is possibly useful to include where you've done your placements on your CV. It won't be something that you need as you go further in your career, but at this stage it might be quite useful. A cover letter, so you do need to write a cover letter for St. John of God, which you don't need to have for Grad Connect. That's a maximum of 1 page. So you need to have evidence of your citizenship, residency, or working visa. So basically what this means is they do consider applications who are international residents, but you must already have a working visa for the full 12 months. They will not sponsor you for a working visa, and they do state that they do give preference to Australian citizens and permanent residents. And they just want a copy of your recent academic results, so a statement of results, so you can kind of just print a copy from SOMO, or you can go into Student Services and pay and get a proper copy printed out from there. And they do want a copy of your most recent clinical placement record. If you do not have, like if you haven't photocopied, or if you're not using, I think you guys use PebblePad now, but if you don't have a copy of that, contact your unit coordinator ASAP. You can organise an appointment with them to go in and photograph the record. But do it ASAP if you don't have a copy, because it can take a couple of days to get that sorted out. Really important, the closing time for St. John of God, because they recruit across the whole country, is in Eastern Standard Time. So when they say that it closes at 11:30 p.m. Eastern Standard Time on the 15th of July, that means it closes at 9:30 p.m. in Perth. So one, don't leave it to the last minute, but like seriously, don't leave it to the last minute. And remember, it may close earlier than what you think. So the cover letter first. So what I would do in my cover letter is so briefly talk about yourself and just sort of say anything that might make you stand out. Did you lead any student clubs? Did you do an international placement? Were you a student mentor? So for example, if I was writing this cover letter, I might talk about the fact that I was on the Vice Chancellor's Advisory Committee and that I did an international placement in Tanzania. Things that might make me stand out from other nursing students. I would also use a couple sentences and kind of weave the St. John of God missions and values into your cover letter. So for an example of this, so I would say like during my nursing studies, I've developed a passion for providing compassionate and respectful care for my patients. This includes continuing to learn and grow my practice to ensure that I'm striving towards excellence in my nursing care. My personal nursing philosophy of always providing dignified, respectful, safe and personalised care for my patients aligns with St. John of God's missions and values, and therefore I'm seeking the opportunity to work with you as a registered nurse. That one's slightly clunky, but basically the idea is like look at their missions and values. It is kind of listed as one of their essential selection criteria. You're not going to specifically address it in your selection criteria, but your cover letter is an opportunity to weave in that awareness. Not from St. John of God, but as someone I talked to who works in recruiting in Department of Health said, like always kind of do that, like even if it's just like a nursing philosophy at the start of, you know, your resume or something like that, something that talks about that company's values and like their mission and their core values and such. Like in his particular words, you're bullshitting. And they know you're bullshitting, but at least you've put the effort into finding out what their values are and incorporating that into your application. Even though everyone knows you're just waffling it to get a job, you're at least proving that you're putting effort into finding out what that company values. So the first selection criteria for St John of God is the ability to demonstrate sound conflict resolution, negotiation, and problem-solving skills. So demonstrate, you've got to give examples that you have this ability. Don't just talk about what conflict resolution and negotiation and problem-solving skills are. Give them examples of how you've used that. And remember, you've got the three aspects, so conflict resolution, negotiation, and problem-solving skills. And that doesn't necessarily mean that you have to write like, I have conflict resolved by doing this, I have negotiated by doing this, I have problem solved by doing this. So kind of like a really kind of brief little example I've got is, so during clinical placement, I cared for a patient who required IV antibiotics but had no IV access. The patient was refusing to have a cannula inserted. I listened to the patient's concerns and discovered that they had experienced multiple painful cannulation attempts in the past. The patient agreed to have a cannula inserted if a topical anaesthetic was used prior to the insertion. I discussed this with the medical registrar who prescribed a topical anaesthetic which I applied prior to the reinsertion. The patient was able to receive their course of IV antibiotics. So here, like, I'm showing negotiation, problem solving. I've resolved this issue. So obviously this is just a really brief little example for you guys. You've got 300 words. You're going to go into more depth. So the next one is commitment to personal and professional development. Now this question is it's a bit more vague. It's not saying you don't have to demonstrate that you've done this. It's just saying they want you to show that you have a commitment to this. I would still kind of want to make sure that I'm providing examples of how I've done that. So again, just like a rough little paragraph that I've put together for how I would answer this kind of question is, so as an RN, I have a professional obligation to ensure that I continue to develop professionally and personally. Whilst in my clinical placement in ICU, I located the ward education calendar and liaised with the staff education nurse to attend toolboxes held during the week to grow my clinical skills and knowledge. This included improving my skills regarding ECG interpretation and monitoring a ventilated patient. I also have membership to the Australian College of Nursing, which gives me access to webinars, online learning and professional development. Whilst being a student, I have engaged in reflective practice, which allows me to identify opportunities to grow as a nurse both personally and professionally, and I intend to continue to ensure that I engage in reflection as a registered nurse. So again, this is quite rough and clunky. This would kind of be like my beginning draft, and then I would kind of want to make this flow better, develop it out a bit, but I'm just sort of putting this together for you guys quickly because you don't have that much time to do your applications. They close in a week. And so the final question, this is a really common question. This is basically, I think Grad Connect asks almost exactly the same question. It's clinical knowledge and experience in the delivery of evidence-based nursing care within the practice setting. So you want to show knowledge and experience, and this is about evidence-based nursing care. So first of all, what is evidence-based practice? You're going to demonstrate that you know what that is. And experience, you want to give examples of how you've used evidence-based practice. So for example, how do you display that you have knowledge of evidence-based practice? Include a brief definition. At university, I've learned about evidence-based practice where best available evidence is combined with clinical knowledge and patient values to ensure the highest quality and safest care. This means that nursing practice is dynamic and adaptable as new research evidence becomes available. So your examples of evidence-based practice, remember, these don't have to be something like some wild new piece of research or things like that. Almost everything we do is evidence-based. It's things like aseptic technique, wound dressing choice, hand hygiene, sitting your patient out of bed. It's evidence-based practice of showing that improves outcomes and recovery. So again, like a brief little summary of an example that I used for this in my Grad Connect application. So whilst on clinical patient, I identified that a patient's CVC dressing was day 7. Evidence shows that changing CVC dressings every 7 days or sooner, if compromised, reduces the risk of infection. Under supervision of the RN, I changed the CVC dressing using aseptic non-touch technique. I applied a Tegaderm with chlorhexidine gluconate dressing, as evidence shows that the CHG dressing reduces the risk of infection, whilst a clear dressing such as a Tegaderm allows for regular inspection of the site for signs of infection. So this is really brief and summarised. I wouldn't necessarily use abbreviations in your actual application, or make sure you define your abbreviations. But this is just kind of an example of showing like it doesn't have to be necessarily something massively complicated. I did a simple dressing change on a cannula, but I used multiple different evidence in supporting when I changed that dressing, what dressing I changed, what dressing I used, and the technique that I used. So hopefully that's kind of going to help you as you put together your application for St John of God and is useful to you.